When it comes to our health, the foods we choose have a profound impact on our bodies, especially in relation to blood fat levels, also known as blood lipids. Elevated blood fats, particularly cholesterol and triglycerides, are major risk factors for cardiovascular disease, the leading cause of death worldwide. Understanding which foods can significantly raise these levels is crucial for making informed dietary decisions. In this exploration, we'll delve into 5 foods that have been scientifically shown to increase blood fat levels, supported by concrete data from reputable studies. We'll examine not just the foods themselves, but also the mechanisms by which they affect our bodies, so you can make choices rooted in evidence rather than hearsay. Let's begin with one of the most well-known culprits: processed meats. Processed meats include items like bacon, sausages, hot dogs, salami, and deli meats. These products are not only high in saturated fats, but they also often contain trans fats, both of which have been linked to elevated blood cholesterol. A study published in the American Journal of Clinical Nutrition found that individuals who consumed the highest amounts of processed meats had, on average, a 10% higher level of LDL cholesterol, the so-called bad cholesterol, compared to those who ate little or none. In addition, a meta-analysis in Circulation, a journal of the American Heart Association, noted that just 1 serving per day of processed meat was associated with a 42% increased risk of developing coronary heart disease, a risk directly tied to higher blood fat levels. The underlying reason for this effect lies in the composition of processed meats. Saturated fats raise LDL cholesterol by reducing the liver's ability to remove it from the blood. Meanwhile, trans fats, though present in smaller amounts, can both raise LDL and lower HDL cholesterol, the good cholesterol, further tipping the balance toward unhealthy blood fat profiles. Moreover, processed meats are often high in cholesterol themselves, with a single sausage patty containing about 30 milligrams of cholesterol and 8 grams of saturated fat. The cumulative effect of regular consumption is a steady, measurable rise in blood fat levels, as confirmed by numerous clinical trials. Next, let's turn our attention to another dietary staple: full-fat dairy products. This category includes whole milk, cream, cheese, butter, and yogurt made from whole milk. According to data from the Nurses' Health Study, which followed over 80,000 women for more than 2 decades, those who consumed the most full-fat dairy had significantly higher total cholesterol and LDL cholesterol levels. Specifically, replacing 2 servings of low-fat dairy with full-fat dairy was associated with a 6% increase in LDL cholesterol. The science behind this is straightforward. Full-fat dairy is rich in saturated fatty acids, particularly palmitic and myristic acids, which are potent stimulators of hepatic cholesterol synthesis. When you consume these fats, your liver ramps up cholesterol production, leading to higher levels circulating in your bloodstream. For example, just 1 ounce of cheddar cheese contains about 6 grams of saturated fat, which is nearly a third of the daily recommended limit for an average adult. Clinical trials have shown that diets high in full-fat dairy can raise LDL cholesterol by 8 to 10% within a matter of weeks, a change that translates directly into increased cardiovascular risk over time. Third on our list is a food that may surprise many: commercially baked goods. Items such as pastries, cookies, cakes, and certain types of bread are often loaded with both saturated and trans fats. According to a study in the journal Lipids, participants who consumed just 2 commercially baked muffins per day for 6 weeks saw their LDL cholesterol rise by an average of 12%. The reason is that these foods are often made with partially hydrogenated oils, which are a primary source of artificial trans fats. Trans fats are particularly harmful because they not only raise LDL cholesterol, but also decrease HDL cholesterol, creating a double jeopardy for heart health. The Nurses' Health Study found that for every 2% increase in energy intake from trans fats, there was a 23% increase in the incidence of coronary heart disease, largely due to their dramatic effect on blood lipid profiles. Even small amounts of trans fats, less than 2 grams per day, have been shown to significantly increase blood fat levels. This is why many public health organizations, including the World Health Organization, have called for the elimination of artificial trans fats from the food supply. Our fourth food is one that's often consumed in moderation, but can have outsized effects. Fried foods. French fries, fried chicken, onion rings, and similar items are typically cooked in oils that are high in saturated and sometimes trans fats. A study published in the British Medical Journal followed over 100,000 people for more than 20 years and found that those who ate fried foods 4 or more times per week had a 37% higher risk of developing high cholesterol compared to those who consumed them less than once a week. The mechanism here is twofold. First, the frying process increases the fat content of the food, especially if the oil is reused multiple times, as is common in commercial kitchens. This can lead to the formation of trans fats, even if the original oil was free of them. Second, the high temperatures used in frying can oxidize the fats, making them more atherogenic, meaning they are more likely to contribute to the buildup of plaques in arteries. For example, a medium serving of fast food French fries contains about 17 grams of fat, of which 2.5 grams are saturated and up to 0.5 grams are trans fats. Regular consumption of such foods has been linked to increases in both total and LDL cholesterol, as well as triglycerides, another important blood fat. The fifth and final food on our list is tropical oils, specifically coconut oil and palm oil. While these oils are often marketed as healthful alternatives, the scientific evidence tells a different story. A randomized controlled trial published in the journal Lipids found that participants who consumed 30 grams, about 2 tablespoons, of coconut oil daily for 4 weeks experienced a 14% increase in LDL cholesterol compared to those who consumed the same amount of olive oil. Similarly, palm oil has been shown in multiple studies to raise both total and LDL cholesterol levels, sometimes to a degree comparable to butter. The reason lies in the unique fatty acid composition of these oils. Coconut oil, for instance, is approximately 82% saturated fat, much higher than butter, which is about 63% saturated fat. The predominant saturated fat in coconut oil is lauric acid, which has been shown to significantly increase both LDL and HDL cholesterol. While some argue that the increase in HDL offsets the risk, large-scale epidemiological studies have found that the net effect of these oils is an unfavorable change in the LDL to HDL ratio, which is a key predictor of heart disease risk. Palm oil, on the other hand, is rich in palmitic acid, another saturated fat known to raise LDL cholesterol. A meta-analysis of 21 studies published in the Journal of Nutrition found that replacing other dietary fats with palm oil led to an average increase of 9.3 mg/dl in LDL cholesterol. This is a significant change, particularly when considered over the long term. It's important to note that not all fats are created equal. While the foods discussed here are known to raise blood fat levels, other fats, such as those found in nuts, seeds, avocados, and fatty fish, have been shown to have either neutral or beneficial effects on blood lipids. For example, omega-3 fatty acids from fish like salmon and mackerel can lower triglycerides and may even raise HDL cholesterol, helping to balance out the negative effects of other dietary fats. The impact of these 5 foods, processed meats, full-fat dairy, commercially baked goods, fried foods, and tropical oils, on blood fat levels is not just theoretical. It is supported by robust, large-scale studies and clinical trials. For instance, the InterHeart study, which examined over 27,000 people across 52 countries, found that diets high in saturated and trans fats were among the strongest predictors of abnormal blood lipid profiles and subsequent heart attacks. Similarly, the Framingham Heart Study, which has followed participants for more than 70 years, consistently shows that higher intakes of these foods are associated with increased levels of LDL cholesterol and triglycerides, and a higher risk of cardiovascular events. But what does this mean for everyday eating? The key is not to completely eliminate all sources of saturated fat, as some are naturally present in healthful foods. Instead, it's about moderation and substitution. For example, choosing lean cuts of meat over processed meats, opting for low-fat or non-fat dairy products, baking at home with healthy oils instead of buying commercially baked goods, limiting fried foods to occasional treats, and selecting oils like olive or canola over coconut or palm oil can make a significant difference. It's also worth noting that individual responses to dietary fats can vary based on genetics, age, and overall health status. Some people may be more sensitive to the cholesterol-raising effects of saturated and trans fats. However, the general principles remain the same. Diets high in these 5 foods consistently lead to higher blood fat levels, which in turn increase the risk of heart disease, stroke, and other related conditions. Beyond the numbers, it's helpful to consider the practical impact of these dietary choices. For example, reducing your intake of processed meats by just 1 serving per week can lower your LDL cholesterol by up to 5 mg/dL, according to a study in the European Journal of Clinical Nutrition. Swapping out full-fat dairy for low-fat alternatives can reduce your saturated fat intake by 5 to 10 grams per day, leading to measurable improvements in blood lipid profiles within a few months. Cutting back on commercially baked goods and fried foods not only lowers your intake of harmful fats, but also reduces your overall calorie intake, which can help with weight management, another key factor in maintaining healthy blood fat levels. In summary, the evidence is clear and compelling. Processed meats, full-fat dairy products, commercially baked goods, fried foods, and tropical oils are 5 foods that significantly increase blood fat levels, as demonstrated by extensive scientific research. By understanding the specific ways these foods affect our bodies, and by making informed substitutions, we can take meaningful steps toward better heart health. Remember, the goal is not perfection, but progress. Small, consistent changes in your diet can yield substantial benefits over time, helping you maintain healthy blood fat levels and reduce your risk of cardiovascular disease.